Good afternoon, everyone. We have 12 noon. We'll just give like 2 minutes for everyone to get signed in. While you're waiting, if you haven't done so already, go ahead and fill out that pre-session survey if you haven't done that yet. We'll get started around 12:02, 12:03. Wait till people get signed in. Hope everyone's doing well today on this rainy Monday. Thanks for joining in. Everyone, like one more minute, and then we'll get started. Welcome everyone again to today's webinar, Recognizing Infection Risks, a review for environmental services personnel. This session aims to empower you as EVS personnel to have the tools to adequately recognize risk in the healthcare environment to provide a safe, clean environment for yourselves, your clients, and others, and reduce the risk of germ spread. And this session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. Thanks again, everyone, for joining us, and thank you for the vital role you play in keeping patients safe while they are in the healthcare setting. Project Firstline intends to provide relevant information and training for all healthcare workers, regardless of role. Nurses, certified nursing assistants, environmental services personnel, doctors, allied health professionals, and other frontline staff in healthcare facilities in the United States. Before I introduce myself again, go ahead and take a look at the chat. You'll find a link to our pre-session survey. Please take a minute to answer the survey if you haven't done so already. This is required in order to receive your certificate of training for today's session. And that survey will close around 12:15 today. I also want to introduce or give Dr. Kearney, Alexis Kearney, our consultant medical director, opportunity to introduce herself today. She'll be with us through the session.
Good afternoon, everyone. So excited to have you here on this rainy Monday. We'll be available for questions throughout the presentation, so please let us know how we can help.
Thank you, Dr. Kearney. So my name is Stephanie Doyle. I'm an infection prevention training liaison for Project Firstline Rhode Island and a community public health nurse at the Center for Acute Infectious Disease Epidemiology here at the Rhode Island Department of Health. I've been practicing healthcare for over 20 years. I've worked in many different roles, which have led me to my current practice in public health and education. Today, I'll be your host and presenter for our interactive refresher session, Recognizing Infection Risks for EVS Personnel. I'm eager to present this topic to you and learn about your past experiences and how those experiences have helped you develop your approach to providing care. So a couple of housekeeping notes before we get going on the material. I'll take a moment to go over our continuing education criteria for those of you who are attending to receive continuing nursing education credits. So this is a 1-hour session and is approved as a nursing continuing professional development activity by the Northeast Multi-State Division Education Unit, an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. So in order to receive your CNA credit, these 4 steps must be completed. So we spoke about the pre-session survey. If you haven't done so, that'll be closing shortly. So go ahead and do that, and the link is in the chat. Second is to attend the live training. And you must also complete the post-session survey, and that will be emailed to you tomorrow. And if you do not wish to receive continuing nursing education, you can just stop there. But if you wish to receive one CNE, you must complete the post-session quiz, and that link will be emailed to you tomorrow as well. Okay, so I also have the Project Firstline team with me behind the scenes in support of the webinar today. And I'd like to introduce Abby Anderson. She is our Project Firstline Rhode Island project assistant. And Abby will be posting information for you throughout the webinar via chat. Now, if you'd like to take a minute and introduce yourselves in the chat by telling us your name and your organization, go ahead and do that. So glad to meet everyone. If you're returning, so happy to see you again, and thanks for joining us today. Everyone is muted, but at the bottom of your screen or at the top, you will see a Q&A box. If you have any questions, please enter them into the Q&A box. We will have some time at the end, hopefully, to review those questions. If not, we will happily send you the answers via email. So put all your questions there. And then the chat box is also open to communicate with our team members and share your experiences and interact with us throughout the session. All right. So on our agenda for today, we've done our welcome and our introductions. We will define risk and risk recognition. Then we'll discuss how healthcare is different. We will have an interactive activity to depict how germs spread and cause infection. We'll then review how to recognize risk using a reservoir and show a scenario about how the germs spread. We'll discuss infection control actions you as EVS personnel can implement when working in healthcare. We'll go over key takeaways and have some announcements at the end. We'll ask for your feedback and allow some time for questions. So at the end of today's session, you'll be able to apply the concept of risk recognition to infection control actions for EVS personnel, explain the 5 elements needed for germs to spread and cause infection, describe the 4 most common pathways for germ spread in healthcare, and recognize when to apply infection control actions to limit the spread of germs. So we'll go right into what does it mean to recognize risk? And what is risk? So before we dive in, I want to reflect on the term environment. So I came across this definition. Environment is relating to the natural world and the impact of human activity on its condition. So I want you to think about that as we go through this material and how the healthcare environment is different and how the environment around you impacts your everyday work. Think about what risks you may encounter that could make you or someone else sick with an infection. So question, what is risk? Thinking about that, how can you recognize risk? Can you think of a time that you recognized risk at home or at work and took action to stop something bad from happening? Think about how you adapted your behavior for yourself and your loved ones during a global pandemic, like working remotely or wearing a mask at the grocery store. So risk recognition is seeing the potential for a problem to happen. Seeing a potential problem does not mean the problem will happen. We can take action to keep something bad from happening. You recognize risk and take action to stop something bad, and that is important. So now I'll just take a look at this example. So I want you to share in the chat, what risks do you see here? What risks are you seeing in this picture? It's a common task that we do. Fall risk. Absolutely. Any other risks anyone sees in this picture here? Example 1. All right, so she's standing on a ladder. She could have potential eye injury. Some sharp object could fall, or light bulb could get broken and a shard could go into her eye. Absolutely. So she's standing on a ladder. She's working with electrical wires. So what are some things these individuals can do to minimize injury during this risky activity? So we talked about a fall. So she has a support person supporting the ladder. So that is an action that was taken to hopefully avoid injury in this situation. And also too, hopefully they turn the electricity off as an action that they could have taken to avoid injury here. Yes, and wearing eye protection, absolutely. Thanks for sharing, I appreciate that. So your example showed ways that we recognize risk in everyday life and how we act to keep ourselves and others safe in those situations. So at work in healthcare, we do the same thing by cleaning up spills or stepping in to help if we see a patient who is unsteady on their feet and could fall. So the same idea applies to infection control. When there's a risk for germs to spread, you do certain things like clean your hands before putting on gloves and after removing them, before doing certain tasks, and cleaning and disinfecting high touch surfaces like door handles and light switches. So, thinking further about the idea of recognizing risk, can you think of times at work when you recognize the risk for germs to spread? What have you done to stop germs from spreading before they cause problems? So, now we'll get into how healthcare is different. So, how is healthcare different? When we think about germs spreading in healthcare, it's helpful to remember what makes healthcare a unique setting with unique challenges and risks for infection control. We think about germs and their risks differently in healthcare than in other places, like at home or in the community. Why is that? Because patients are coming in for care, so there's a higher chance that they already have an infection and they're ill. Because many patients are ill and weak, they're likely to be more vulnerable to infection. So the risk from germs spreading to them are higher. And sometimes the things that we do as part of giving care can actually put people at risk of infection. And finally, the work that we do in healthcare brings opportunities for germs to spread. We have closer interactions with patients during care than people have in the community. We interact with many people and we touch and share a lot of things and equipment throughout the day, which are all opportunities for germs to be spread. That's why infection control is different in healthcare than in other places, and why it's all the more important to recognize the risk for germs to spread throughout your workday. So now we're going to do an interactive activity, and I'll ask for your participation with this activity. First, I'll explain the activity, and then I'll show you a common scene or situation in healthcare, a patient care area. So we'll all take a look at the slide, and I'll invite you all to identify any risks that you see for germs to spread in this scene. So feel free to share them in the chat. And I would also like you to think about any patient care areas that you come across in your daily work. So here are our instructions. So we're going to review the photo on the following slide, identify infection risks, and then we'll share. So we've talked about recognizing risk in general and about how higher risk for germ spread is in healthcare. Now let's work together to identify and discuss some infection control risks. So I want you to picture yourself working the evening shift at a busy urgent care facility. You're assigned to clean and disinfect this patient care area. You gather all your supplies and take a look. All right, so what do you see? I'll give you a minute, take a look around. So what environmental factors in this room have the potential to cause the spread of germs, potentially infecting you or someone else? What are you going to do as the person responsible for making sure germ spread is prevented from potentially infecting the next person who uses this environment? What about protecting yourself as well? What precautionary measures, what actions will you take to protect yourself from acquiring an infection from any one of these potential risks? All right, so I see some answers coming in. Sharp's container is overflowing. Absolutely. So what are we looking out for there? Risk of Sharp's injury. Sharp's overfull. The garbage needs to be emptied as well. Anything else anyone sees, anyone wants to share here? Biohazard sign, right? What is that for? What is that in use for? We see the sign, but we don't see any, it's attached to the wall, so not quite sure what's a biohazard there. Looks like used gauze or cotton balls. Yeah. So shared patient care equipment is just left there on the counter. All right, very good. So let's go through a couple of these. So first, I identified the sink. So the sink there, germs live in water and wet surfaces. So that is a, definitely a reservoir where germs could live. So how many people have washed their hands, and when was the last time that sink was cleaned and disinfected? This is a likely area germs can spread through splashes and sprays of environmental surfaces. The counter is left unprotected from splashes and sprays. So that leads us there to the countertop where you pointed out there's some items, some shared, possibly shared patient care or used patient care items there. This too is a hard, dry surface where germs live for unknown periods of time. Certain resistant strains of bacteria and viruses can live in the environment for months, if not years, if not killed with an approved disinfectant. So what else do we see on the countertop? So we want to make sure that's clear and clean, discard any shared or used equipment. And this too can be contaminated. The equipment can be contaminated with splashes and sprays from the sink, and hopefully it's not used on multiple patients. And yes, the elephant in the room, the overflowing sharps container. So sharps can be handled with care. And I just want to add, we do have a full sharp safety webinar that is available if you would like more information on proper handling of sharps. But yes, absolute infection risk for anyone who enters this room. And also, too, if you can see, one sharp did fall into the waste receptacle. So that is definitely a risk for bloodborne pathogen transmission. So how would you handle this container? What would you do here? What are some actions you would take? Definitely make sure you have the correct personal protective equipment to protect yourselves. Make sure no one enters that room until that's taken care of. All right, so we looked at 3 potential infection risks here in this scenario. It helps us think about what risks we come across in our everyday work in healthcare. What are some risks that you see in your daily work when you're responsible for cleaning and disinfecting patient care areas? Thank you so much for participating, and hopefully we don't come across a scene like this, but good learning opportunity. So again, reflection. What is one risk for germs to spread you might recognize in your daily work? And when you recognize that risk, what's one thing you can do to help stop germs from spreading? All right, so now we'll talk about how germs spread and make people sick. So how's the germ going to spread? Germs are everywhere, including in and on the human body and in the environment. Many of these germs are normal and even keep us healthy. Our bodies are very good at protecting against many germs, but when patients in healthcare are weak or ill, their defenses may not work as well. Also, some germs can still cause infection in someone who is healthy. In order for germs to make someone sick, 5 things are needed. So first, germs need a place to live. Yep. So we did talk about the sink being a reservoir, and we do call these places reservoirs, essentially like habitats. Reservoirs can be in the human body, the skin, the digestive system, or the gut, the lungs and airway, and the blood. Reservoirs can also be in the environment, water and wet surfaces, and dry surfaces that have water on them, dry surfaces like countertops and bed rails, dirt and dust, and devices. It's an overview of reservoirs or habitats where germs live. Second, they need a pathway. Because they typically can't move on their own, at least not very far, germs need a way to get from where they live to another place or person. And we'll talk about pathways in detail in a moment. They also need a person to infect. That person can be a patient or you or one of your colleagues. Germs also need to get around the body's natural defenses to make someone sick. And survival. Germs need to survive so that they're still able to make someone sick. Keep in mind that germ spread and infections can be prevented. Acting on one or more of these 5 elements can keep germs from spreading and keep people from getting infected, and that is infection control. Now that we've talked about how germs spread and make people sick, let's talk about how that usually happens in healthcare. So, at any point in a patient's stay in a healthcare facility, a person can become sick with an infection. We've reviewed the 5 key elements needed for germs to survive and cause illness. You, as EVS staff, play a key role in stopping the spread of infection. Infection control actions can be taken to minimize the risk of someone becoming sick. Knowing where germs live and how they travel from place to place, person to person, and from the environment to a person is key in stopping the spread. Now that we know how germs spread and make someone sick, let's talk about common pathways or how germs get to a patient, enter the body, and lead to infection. So how germs spread in healthcare are 4 main pathways. So in most cases, there are 4 main pathways for germs to be spread from reservoirs in healthcare. The first is through touch, and that usually involves the skin, especially the hands, but it also happens with devices which touch different people and surfaces. Another pathway for germs is through breathing in. A third is through splashes or sprays of blood, body fluid, or water from a sink or other sources. Germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or into a cut or break in the skin and cause infection. The last common pathway for germ spread in healthcare is through clinical care tasks that bypass or break down the body's natural defenses, like when a patient's skin has to be broken to insert an IV. That creates a pathway for germs to enter the patient's body. So how germs move around in the healthcare facility? So germs move from place to place and to the patient. Contact is the most common way germs move around us. As EVS personnel, you are touching so many different things in the environment throughout your workday. Safely and adequately removing the risk of germ spread from hands and environmental surfaces or reservoirs has an impact on the overall health and safety of vulnerable patients in the healthcare setting. Touching the equipment in the room, then touching the patient and or things the patient may have touched, touching the door handles, call light, side rails, toilets, sinks, TV, call remotes are examples of surfaces that are commonly touched by the patient and the healthcare worker. Germs can also move on wheelchairs, stretchers, beds, and other medical equipment the patient uses. As you think about germs spreading, also continue to think about what actions can be taken at each of these intervals to prevent the germ from spreading and contaminating other reservoirs, such as proper hand hygiene, cleaning your hands at appropriate times, such as before and after glove use, proper use and selection of personal protective equipment. And remember, gloves are not a substitute for hand hygiene, and cleaning your hands must be performed before and after glove use for optimal chance to reduce the risk of spreading germs. Cleaning and disinfecting appropriately. So, do you have the tools to perform each action safely and appropriately? So, I just wanted to briefly show 2 examples of contact surface types. So we have low touch surfaces, such as ceilings and floors, and high touch surfaces, which are pointed out here in this picture. Why are we differentiating the 2? So why would we differentiate the 2, low touch and high touch? Does anyone have any ideas? You can go ahead and share in the chat there. So why would we differentiate low touch and high touch surfaces? All right, so these high touch surfaces are surfaces that the patient comes in contact frequently or other healthcare workers. So those are going to be the most contaminated surfaces. So those will be the highest number of germs present in the room. So bed rails, the bedside table, privacy curtain, sinks, and toilets. Can you name any other high-touch surfaces in this picture? And Lynn says yes to prioritize disinfecting. Right. So we're going to clean all the low-touch surfaces, and then we'll clean all the higher touch surfaces, going from clean to dirtier. And that leads me to my next question. Which surfaces would you think should be cleaned first and why? And what should be cleaned last? So we always leave the dirtiest surfaces for last. So high-touch surfaces are surfaces and equipment that are most likely to be contaminated by germs. This can be different in different patient care environments. Think about the spaces you're responsible to clean and disinfect. Establish a pattern and follow a standard cleaning process to ensure consistency in cleaning and to prevent cross-contamination. And remember, knowing where germs live and how they spread helps you recognize risk. Infection control actions at any one of the key points we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it's important to think about where the germs are, which reservoirs you're dealing with, and how the germs might get somewhere else, the pathway. Then you can recognize the risk for germ spread and do something about it. So here's our first poll question. High-touch surfaces in the healthcare setting include A, light switches, B, stretcher rails, C, blood pressure cuffs, D, sinks and faucets, E, none of the above, F, all of the above. So I'll give you a minute to answer that for us. All right, we have about 50%, 53%. Anyone else want to answer? Go ahead and tell us, what are the high touch surfaces? All right, I guess that's going to get 53% answered. All of these, which is correct. Yes, all of these are considered high touch surfaces in the healthcare setting. All right, very good. Thank you for participating in our poll. Appreciate that. All right, moving on. So now we're going to do a little activity and talk about how can an infection occur. So we've talked about germ spread and how germs can cause infection in healthcare. So let's imagine a few scenarios where it could happen. I'll walk you through a scenario as an example. I'll start with the germ and the initial reservoir, and then I'll walk through some possibilities for each of the 5 factors of germ spread. In the end, a patient could be infected with this germ. Of course, there are infection control actions that can keep the germ from spreading, but for now, we're focusing on how germs spread and make people sick. And it's not necessary to know everything about the germ that we're using in the activity. The point is to think through the elements of how germs can spread. Right, so let's get started. So our germ is strep. Streptococcus or strep can cause many different types of infections that range from minor to serious. Infections caused by strep are more commonly known as strep throat, cellulitis, necrotizing fasciitis, among others. Strep can affect the respiratory tract, skin, and may even cause bloodstream infections. Strep is spread through respiratory droplets and direct contact. So our reservoir here is the skin, a healthcare worker's hands. What is a pathway for the germ to be spread from the hand? The worker could touch the bed rail in the patient's room without cleaning their hands first. And recall the 5 elements of how germs spread and cause infection: reservoir, pathway, a person, a body's defenses, and survival. All right, so here's our example scenario. So the germ is strep. The germ is on the healthcare worker's hands on the skin. So that is our reservoir. So the healthcare worker now touches the bed rail. The germ is now on the bed rail. From there, how can it get to the patient? The patient could pick up the germ on their hand when they touch the bed rail, if it hasn't been cleaned and disinfected first. The patient could then rub their eye, delivering the germ to their body. The germ has survived because the bed rail was not cleaned and disinfected, and the patient's natural defenses cannot fight it off. The patient now has an infection. Now, the way that I just outlined the 5 elements in this example isn't the only way germ spread could happen. In fact, there are many ways that the elements could work in this scenario for an end result of the patient becoming infected. It's also important to remember that the elements aren't steps in an order and that it's not inevitable that someone will get sick from a germ. Infection control actions keep germs from spreading at any point. The reservoir, pathway, the new person to infect, their body's defenses, and the survival of the germ itself. So your role as EVS personnel is extremely important. EVS personnel are key players on the infection control team, stopping germs in their tracks and preventing unnecessary illness. Your job, what you do every day by cleaning and disinfecting patient care areas and everyday items patients touch, is vital to the healthcare facility, the safety of our patients, visitors, staff, you, and your colleagues. So, a brief reflection. Understanding how germs spread and make people sick is an important part of recognizing the risk for it to happen and choosing infection control actions that will keep germ spread from happening, which protects your patients and yourselves. All right, so we'll wrap up with a review. Recognizing risk using a reservoir. And we'll bring everything all together. So when we think about risk and infection control, we think about seeing the possibility that something bad might happen, that a germ could be spread and infect someone, and taking action to keep it from happening. As we explore the idea of recognizing risks for germ spread in healthcare, it's helpful to start with where we find the germs, where do they live, what are their reservoirs? When we think about how they get from place to place or to other people, what are their pathways? In healthcare, we think about germ reservoirs in the human body and in the healthcare environment. Reservoirs in the human body are the skin, the gastrointestinal system or the gut, the respiratory system, and blood. Reservoirs in the healthcare environment include water and wet surfaces, dry surfaces, dirt and dust, and devices. There are a few common pathways for germs to be spread from reservoirs in healthcare: by touch, when they are breathed in, through splashes and sprays to the eyes, nose, or mouth, or to broken or unhealthy skin, and through things we do as part of healthcare that bypass or break down the body's natural defenses. For instance, procedures and surgeries that require breaking a patient's skin can allow germs from the patient's skin to get into their body. Anything that we do that involves touch, whether it's touching a person or things in the environment, like blood pressure cuffs or IV poles, can be a risk for germs to spread. So there are more pieces to the puzzle of germ spread than reservoirs and pathways. Germs also need to arrive at a new person, and that person could be a patient or you or one of your colleagues. And in order to infect them, the germ needs to get around the person's natural defenses. If the person is already sick, their immune system could be weak and not able to fight germs as well as a healthy person's can. If their skin is broken from having an IV inserted, for instance, germs can enter their body through that break in the skin defense. Throughout all of these elements, the germs need to survive in the environment if they're going to make someone sick. That's called being infectious. The infection control actions that you take at any of these points help keep germs from spreading and causing infection. Now we're going to use what we know about reservoirs and pathways and how germs make people sick to discuss a scenario. So how did the germs spread? So I'm going to present a brief scenario in which a patient has different interactions with different healthcare workers. So our scenario is in a patient's room and the patient is in bed. So first, a doctor comes in doing rounds and will enter the room to conduct a brief physical exam. Next, a nurse will enter to check the patient's vitals and ask a few questions about how they're feeling. Then an EVS worker will enter to do the daily cleaning of the room, which includes greeting the patient, cleaning and disinfecting high-touch surfaces, cleaning the bathroom, and emptying the trash. At some point, staph, which is our germ, which we'll explain on the next slide, has been spread to the patient. The outcome is that a germ, in this case, Staphylococcus aureus or staph, has spread to the patient. I will ask you to provide the potential reservoirs and pathways that could have been involved in the germ spread. Then we'll discuss the common reservoirs and pathways and draw on your experiences to show how staph made this patient sick. So just a brief overview of our germ, Staphylococcus aureus. It's a common bacteria, and most of the time it doesn't cause any harm. It can, however, cause serious or fatal infections, especially in patients in healthcare. Some types of staph are resistant to antibiotics, which means that the germs have developed the ability to defeat the drugs designed to kill them. So anyone can get an infection from staph, but some groups are at higher risk than others, including people with chronic conditions and patients in healthcare. So for our discussion, we're going to focus on how staph spreads by the touch pathway. As a reminder, these are the common reservoirs and pathways in healthcare. So that's up there for your review. So let's start with the likely reservoirs for staph in the healthcare setting. Let's share in the chat some reservoirs where staph may be living on the body or in the environment. So go ahead and share in the chat there. Where do you think staph might be living? All right, so staph can live on instruments, so any instruments that are used to help care for the patient, can live on the patient's skin or the healthcare worker's skin as well. Right, so those are some potential reservoirs where staph can live. So staph is found on the skin and spreads easily by touch to and from skin, dry surfaces, and devices. With that in mind, we can narrow down to our pathway. And the main pathway for staph to spread is by touch. When staph causes infections, it's because a person's natural defenses have been bypassed or broken down, such as through a needle stick or wound, and staph has gotten into the body's bloodstream or tissues. But before staph can cause infection, it first has to be spread to the person, and that happens through touch. So keep this in mind as you think through how staph could have been spread to the patient in our scenario. So go ahead and share in the chat if you'd like some potential reservoirs and pathways that staph could have spread, and I'll read through some scenarios as you share. So staph might have been living on the bedside table, on the IV pole, on the bed rail or shared equipment, a stethoscope, the healthcare worker's hands or clothing, and the patient may also be colonized with staph. Now that we've highlighted some reservoirs and pathways, what are some actions that we can take to reduce the risk of spreading? So let's say the nurse comes in and performs wound care and uses that bedside table to prepare the field. The nurse places the soil dressing on the table and drainage seeps through and contaminates the table. The nurse wipes down the table and leaves the room. The table was not disinfected. So the next person to touch that table without gloves may get staph on their hands. And if they do not perform proper hand hygiene, if they don't clean their hands, they could touch the bed rail of another patient, leaving staph on the bed rail. In our scenario, the EVS personnel comes in, moves the table, and unknowingly gets staph on their hands. Hand hygiene is definitely very important in these scenarios. So we identified several different opportunities during these interactions that staph could spread to the patient and make them sick. No matter your role, each patient interaction provides a risk, an opportunity for germs to spread to a patient. All in all, when we realize where germs live in healthcare, we can intervene and take action to limit and even eliminate germ spread. When we hold ourselves and others accountable, we have good outcomes and we reduce illness and infection. So let's take action. What actions can we take at any point in the scenario to stop that germ from spreading? Go ahead and share. I see, Lynn, you shared hand hygiene. Absolutely. Knowing what times and how to properly perform hand hygiene is very important in stopping the germs from spreading. So, what tools do you have available to perform adequate hand hygiene in your everyday work? Are you using alcohol-based hand sanitizer? Are you washing your hands? Yep, wash your hands before and after, using gloves. Absolutely. Gloves are not a substitute for hand hygiene. So, better hand hygiene. Cleaning and disinfecting appropriately. What tools do you have available to help you do your job correctly and clean and disinfect appropriately at appropriate times? Using gown and gloves. Proper use and selection of personal protective equipment. Do you have those tools available to you in your job? Decolonization of patients can also occur, and education of staff, continuing education of staff, making sure they understand what is expected, and continuing that education, observation, auditing, making sure everyone knows what is expected to help keep everyone safe. All right, thanks for your participation. I really appreciate that. So, thinking about your daily work, what is one step that you can take to recognize an infection risk and take with you one action you can take to stop the spread of germs? So, we've used our knowledge about reservoirs and pathways to recognize the risk for germ spread. Let's reflect on your work and your work experiences. So, EVS personnel play a vital role in the safe delivery of healthcare. Cleaning and disinfection in a safe and organized way can help stop the spread of infection. Implementing standard precautions and knowing where germs live and how they move from place to place is important when applying principles of cleaning and disinfecting in the healthcare setting. Protect yourself and others by taking precautions such as hand hygiene, and using PPE properly in situations where there is a risk of infection. You can help control infections in healthcare by learning to recognize the risk for germs to spread and cause infection and not letting that happen. Healthcare is a unique setting, and we consider germs differently in healthcare than we do in other places. 5 elements for a germ to spread and cause infection: reservoir, pathway, person to infect, getting around the body's defenses, and survival. And germs are found in certain places called reservoirs and need a pathway to spread to other places and people. Main pathways for germs to spread in healthcare are touch, breathing in, splashes or sprays, bypassing or breaking down the body's natural defenses. When you recognize risks for germs to spread, you can choose the right infection control actions to keep it from happening. Thank you for your time and attention today, and I hope that you can take these ideas and apply them to your everyday work. Here are references for today's session. And before we wrap it up, I'd like to remind everyone there are a few requirements to receive your certificate of training. You must have completed our pre-session survey, participate in today's session, and complete the post-session survey. And a link will be emailed to you tomorrow. And that will close in 1 week after at midnight. And once you complete the requirements for a certificate, that will be emailed to you in a PDF. And if you would like to receive continuing nursing education, don't forget to take that post-session quiz. Here are our resources, and you can follow us on any of these social media sites. We do have a lot of information that we share. You can sign up for our newsletter and our upcoming training sessions, and Abby's posted the link there in our chat as well. I'm very excited about these two upcoming sessions to go a little bit further into a deeper dive for EVS personnel. We have coming up part 1 and part 2. So go ahead and click the link there if you want to sign up for those upcoming sessions. Part 1 is August 26th, part 2, August 29th, and that will be presented by my colleague, Allison Thurber. And if you could please take some time, we have a few minutes left to fill out our end of session feedback poll, and this will help us to improve our future training to suit your learning needs. All right, and I think we just have a few more minutes. If you have any questions, we covered a lot. If anyone has any questions, please feel free to enter those into the Q&A, or we can unmute you if you wanted to share that way. And again, I appreciate everyone spending the time today to continue to educate yourselves and hopefully share with others what you've learned in order to provide the best care possible to the patients in our community. Thank you so much. And I believe there will be a recording available at some point, but we can definitely follow up with an email to you with that information.
And I would just add one thing. If there's ever a time where you feel like you're going to have a bunch of people together and would like an in-person educational session, we are more than happy to come and provide educational sessions in person if that is better for your facility or your staff. And that goes for anyone on the call or any other organizations that you work for as well. Just reach out to us and we're happy to coordinate something that works for all of you.
All right, and thank you, everyone. I don't see any more questions, and we'll wrap up for today. Again, thank you very much, and enjoy the rest of your Monday and the rest of your week. Thanks again, and take care.